Hey Jay, how's it going?
I'm doing great, man. How are you?
Doing well, thank you. Looks like the eye is back to normal there.
Yeah, thank you for that. Man, it's like one of those freaky things that reminds you that you're a vulnerable human. I like woke up one day and my eye was like I looked like Rocky Balboa, as I told you. It was
Yeah, those things
wild.
just pop up from time to time. Usually about, when I'm about to travel or something like that.
Yeah, we just got back from Europe, so I'm sure I was like just touching everything, and
Yeah.
it's just crazy when your body doesn't do what you want it to do, which is a great segue to having you on here. So thank you.
Yeah. No, I'm glad to be here. I'm excited to get into this conversation today.
So, and I'm a fan of your podcast with Kyle, and love listening to all of your topics. And I listened again to the episode about you, which I found so interesting because I'm an artist. I don't know how much if you looked into what I do. So listening to your background and the way your brain works is very different from me, and the fact that I focus a lot on my right brain side, but I also have a very
Mhm.
strong like analytical side as well. So I'm looking forward to kind of blending those two together as we touch base. You had mentioned in your podcast about yourself and also on your website about um your journey towards becoming a medical practitioner involved breaking a lot of bones. I was wondering if you can kind of touch more upon that. Like what the heck kind of kid were you? What were you up to?
Yeah, so I guess that was before the rational part of my brain took over. I
Okay.
can kind of think of myself as maybe even hyper rational at this point in my life. But yeah, I guess I was, I don't know, injury prone or took risks or whatever the term you want to use is there. But yeah, I broke a lot of bones. So I was in orthopedic offices, in emergency rooms, had casts put on, back when people signed the cast. I guess they still do that. But around age 16, I stopped breaking bones. So either I like started making more intelligent decisions or realized I had like a job at that time,
Yeah.
responsibilities, wanted to be playing sports and not sitting on the sidelines in a cast, those sorts of things. So yeah, trampoline, falling out of trees, all kinds of things like that that kids do, and that I did, and that led to those fractures that I had.
Mm.
And the one incident that was probably the most profound was I had actually broken. This was the tree incident. I had broken both bones of my right forearm, so the radius and the ulna. And the initial break didn't cause this complication, but when they went in and put a rod in my radius to stabilize that bone, then I had a complication from the surgery called compartment syndrome. For the audience who may not be familiar with that, basically you have such an amount of swelling that it cuts off the blood supply beyond that point in the arm. So,
Mm.
like my hand in this example would be lacking blood flow. It would be putting pressure on the nerves, and if it's not corrected, then you can have lasting nerve damage or even loss of the hand. In my case, I was, very lucky, very blessed. My mother got me to the hospital, and I had a good surgeon who was able to recognize the orthopedic emergency and then correct that. And I still have full function. I have some scars, but it just reminds me of how lucky and blessed I am. And I think that's really what shifted me to go into healthcare. Aside from always liking the sciences, that experience on the patient side of things really steered my trajectory.
So I'm like interested in digging a little more in the hyper analytical side, like you're talking about. You went into becoming a nurse practitioner, which, if I heard correctly, kind of started out as just kind of wanting to be like more of a nurse at first. And from my understanding, I could be wrong. Tell me if I'm wrong, but like I always assumed that more that people that got into being a nurse or things like very on with patient spending a lot of time your time with patients. I thought that that would involve a lot more of the more nurturing side of your brain as opposed to the analytical. Is there a balance for you, or is it very much for you like you love solving the problems, or is it what is it for you that got you wanting to do this? Is the solving the problem part, the finding the truth, the finding how to fix things, or is it like the nurturing side, or is it all of it? I want to kind of understand that.
Yeah, it's a great question. I guess there's a lot of different elements there when you're looking at what goes into just taking nursing. So the nurse most people are familiar with would be an RN, registered nurse that works in a hospital or a doctor's office, those sorts of things.
Mm,
And that's what I was for the majority of my in the hospital career.
okay.
And there is the patient care aspect, being personable, talking to people, taking the time to listen, the physical touch, things like that, that really make a difference in a patient's experience and can actually affect, outcomes, because people are very isolated. A lot of times it's not expected that they're going to the hospital. Certainly that was the case when I was working in the cardiology unit. And I guess that's the more, artistic side. It's not necessarily, there's an art to nursing, and there's also a lot of things that are just very rational. It's like, okay, when this happens, we know we do this. So if you look at like back when we used to run, code blues, people would have their cardiac arrest, go into a rhythm without a pulse. There's an algorithm for that. You do this when this happens, you look for the reversible causes, and then those people get transferred to the ICU. So there's this hyper rational side of it. It's like, okay, when this happens, you snap into a like, okay, this is the checklist. These are the things you go through. You make sure you don't miss this. You make sure you do it in this order. And then you also have the majority of the time where it is, just trying to make the biggest difference in your patient's experience and for a positive patient outcome. So like you said, the fixing things, that was my initial thought. I had this orthopedic surgery and I was like, oh, that'll be great. I'll be an orthopedic surgeon, because that is very like hyper rational. There's a bone that's broken, you put it back in place. You've got a hip that's bad, you put a new one in there. And that was something that was interesting to see when I worked in orthopedics, naturally. My first job, seeing that mindset shift where people are like, oh, instead of this pain getting worse and worse, this pain is going to get better. And there's even a bit of art that goes into that orthopedic process. I've realized as I've gotten more educated in medicine, they've got, even, 3D printed joints. If you're looking at something that's very cutting edge now, different sizes for different patients. And you're looking at, okay, what's this person's bone density? What kind of activities are they going to be doing?
Mm,
So there's a lot of a balance there. And I guess in my practice today, it's evolved to the point where I look at, okay, this is the individual, these are their goals, these are their values. And then I have in the other circle, you can imagine kind of like a Venn diagram. On the other side, you have all the possible interventions that can get that person to that goal.
mhm.
So if I tell someone, they're like, hey, I need to, get my, cholesterol under control. Well, if someone goes on a vegan diet, cholesterol is probably going to improve, but does that align with that patient's goals? Is it the diet that they want to eat? Is it, something that's going to be workable for them? So I
Mhm.
guess that's where the kind of art would be in my current practice.
Do you get involved with their goals? Like if they say to you, hey, these are my stated goals, like I'm sure in the back of your head as a human, you're like, oh, it's kind of effed up. You should have different goals than that, It's like, how much of that is do you let yourself say, hey, have you thought about maybe this goal, or maybe your goals are off? Like how much can you just be like a real person, like a real interactive human being with them, as opposed to being just a practitioner? You know what I mean? Like how much can you really dive in there and help them, or do you want to get involved with that at all? Is it just about like getting their goals met? And is that
Yeah, it's both. So sometimes someone's goal is like, hey, I want to optimize my testosterone. And that's a very common thing now.
mm,
And a lot of times there are roadblocks to that. It's like, well, before we go about, saying let's just fix testosterone kind of on an island by itself, we have to look at the big picture, and see, okay, let's look at maybe your heart health first, because, to me, when I'm looking at someone's path to feeling good in the short term, but also being around for a long time,
mhm,
heart health is going to be very important there. So if someone has an issue with their, blood pressure, testosterone could certainly make that worse. If I just pick an intervention out of the, left circle on the Venn diagram and I say, okay, we'll put you on testosterone, like that person, if they are unhealthy at baseline, yeah, their testosterone may go up on the blood test, but it can unmask or make sleep apnea worse. The blood pressure can go up, the cholesterol can go up. If they're not doing anything from a lifestyle standpoint, is
mhm.
probably going to make them sicker faster rather than giving them the goal that they want as far as the quality of life.
Okay. Yeah, it does seem like a lot of Americans just want the easy pill. And we all have people in our family that just are like, hey, just give me a pill, I'll make it better. And I feel like the more I've listened to like your podcast and Huberman and Atia and all these different podcasts, the more you realize how interconnected everything is. And it does seem that when you take a 30,000 foot view of all of it, how much of I don't know if an art form is the right word to use, but how intricate everything is and how interreliant everything is on each other. So something like hormones, it's a fascinating topic, but it involves everything from from my understanding, everything from sleep to nutrition to exercise, lifestyle, potentially supplements, potentially pharmaceutical. It is so interesting. I'm wondering how much of your practice is spent on preventative versus treatment versus like vanity type topics.
Yeah, if I had to put a percent breakdown on it, I kind of would lump prevention and optimization into the same category. So
Okay.
it may be skewed a little bit that way. I mean, there are things that are, it's like vanity, right? People are like, oh, I want
Sure.
to have, less wrinkles, or I want to prevent wrinkles. And there's things that can be done that have different risk profiles. So like, sunscreen, I guess that's a controversial topic, but that's fairly low risk, probably the lowest hanging fruit in terms of like preventing skin aging and skin cancers, especially if someone has a family history. And then there's things that are like, botulinum toxin that have a little bit more of a risk profile. And then things like, fillers, which have probably the highest risk profile in that category. So, we tend to look at what are the lowest risk interventions that have the highest potential upside, as opposed to like hitting every problem with a sledgehammer, because then, yeah, you get the result, but you have a lot more collateral, a lot more risk that comes along with that. So I would say, the majority of it is probably like an 80-20, where we're focusing on the boring things, right? So like you mentioned, all the inputs that go into testosterone, there's a lot of focus on like the supplement or the pharmacology end of things, as
Mhm.
opposed to like the sleep, the nutrition, the exercise, the nuance there. A lot of people are unknowingly on a like low fat diet, just especially in like the bodybuilding space. They're like, yeah, carbs and protein, and then they're kind of handicapping themselves when it comes to their testosterone production. How big of an effect is that? It can depend. I mean, it could be 100 nanogram, 200 nanogram per deciliter. For the listeners, a standard range is somewhere between like 300 and then 900 to 1,000 as far as the total testosterone.
But then there's like the whole aspect of like the free testosterone or the bioavailable testosterone. It's there's a couple things I want to touch upon that you brought up. One of which I guess we'll touch upon is the testosterone or the hormonal balance. It's one thing to like get everything measured. Blood tests are important. You guys are always talking about that. But then it's like
Mhm.
the average human, you look at it and you're like, what the hell is going on here? Like it's like literally it's become like a full-time passion hobby of mine to try to understand a lot of these topics, as it has for most people of your listeners. I'd imagine it's fun for us normal civilians to try to understand it all, but it really is difficult for an average person to try to not only understand it, but then even harder, I think, is trying to find a like-minded medical practitioner to work with you. Like just trying to find a doctor, a GP for like my annual exams became overwhelming. Are there I'll start here. Are there ways that you would recommend to your friends or family if they're like, look, James, I agree with everything you guys are saying. I understand. I'm trying to do the best I can with all protocols and practices and supplements, but I can't find a doctor that actually gives a crap, or a doctor that thinks out of the box, or a doctor. It's hard to find a doctor or a medical practitioner that's as passionate as like you and your podcast partner, Dr. Gillette. More often than not, you run into doctors that are burnt out from in the insurance system, or burnt out of their job because they've been doing it too long, and they're not keeping up with the data. They're just kind of floating through the day to get to their golf game or their family, which is understandable. How do you weed through all of the options out there to find someone that's like-minded?
Yeah, it's a process, and it can be a long process and very difficult to do in the traditional medical model.
Mhm.
So there are all these sort of alternative health, I guess, which is the bucket that we would fall into, where you have either like a concierge type or a direct primary care type of service, where you are essentially paying to have that time to discuss your goals. But even in that sort of niche, it's important to find someone whose approach kind of aligns with your vision of health. So if your vision of health is to live to 100 and still be able to do all the things that you want to do, then that's something that you need to find people align with. The med Twitter space is really interesting. I kind of chuckle whenever I see these urologists or various specialists that are like, why would you order this test on someone who's 82 years old? It's like, this is ridiculous. And the question is like, well, what is their 82 biologically, but what is their function like? If this person has another 20 years of life left, then that's a very reasonable intervention. I think if we look like several decades ahead, we'll kind of look back and be like, oh, well, that was kind of silly to say, why would we order that test on someone who's 80? Because, our lifespan benchmark may be, 90 years versus the 79 or something like that at that time. But in the traditional, medical model, like finding a primary care provider, I still advise people to establish with someone in that traditional model, because if something does go wrong, you're not just trying to optimize, right? But you end up with say a cardiac arrhythmia, or you're having gallbladder issues, the gallbladder needs to come out. It's going to be much better to be in that network kind of plugged in already, get a referral queued up, as opposed to starting from scratch. So I do advise people to like go and see who's in your network, go read the person's bio. If they have some sort of a like sports medicine aspect to their practice, I found that those guys tend to be, or gals, tend to be very, or I guess not very, but potentially more well-versed, and their goals will align more, as opposed to, someone who, is just kind of your average, let's say, internal medicine physician. So looking at someone's bio, if they mention prevention, if they have a hobby of something like running or weightlifting themselves, so if they're kind of have one foot in this space of optimizing their wellness, I think they'll be more receptive to ideas or questions or things that these people have about supplements. And probably as much as you want to like go into that doctor's office with a list of 50 questions, maybe try not to overwhelm them. Maybe space those questions out a little bit. There's also messaging through an electronic health record. Some clinics have taken an interesting approach to this. I believe the Cleveland Clinic is now billing for questions people ask through the EHR, which I think is kind of an interesting model. I don't know that it's the right answer. They're trying to decrease provider burnout. But in any case, I suppose we'll see how that turns out in a couple of years when they look at the data. And I'm sure the volume of messages will go down, but does that actually translate into better care and better patient outcomes? I don't think so.
I made a list before we started talking of all the things I wanted to talk about. It just started getting way too out of control. So I'll start with this. What are you most excited about? Not necessarily what you focus on to make the most money, because I'm sure those are different lists probably, but what are you most excited about, whether it's where things are potentially going or topics that you just find that when you're not working, you just really want to learn about? Like what are you, James, what are you most passionate about right now when it comes to this field of yours?
Yeah, so even my hobbies there's overlap there with health and fitness, with medicine, with science. So I think the things that are going on at Neuralink are very interesting. I recently watched that podcast with the neurosurgeon and Andrew Huberman. I thought that was really fascinating.
Yeah.
Anything in that sort of regenerative medicine space, I think, is going to be really interesting to watch, because it was moving very slowly for a while. And now I think we're right at the cusp of where that's going to take off exponentially. So look at something like type 1 diabetes. There's a lot of work being done in this space to sort of, they call these insulin pumps like an external pancreas. But there is technology that's being developed where they're trying to encapsulate these beta cells and then basically implant an artificial pancreas inside that person, which functions more like a real pancreas, because you're using beta cells instead of just an insulin pump. And those beta cells are going to produce not just insulin, but amylin, just like a normal pancreas does. So this is kind of interesting. They will kind of harvest these beta cells, or they want to be able to eventually make these from the patient's skin cells, for example. And then they'll infuse them into I believe it's their portal vein, which is part of the hepatic circulation for the liver. It's a large vein, and they get lodged there, and they sit there and encapsulated, they're protected from that immune response that destroyed the patient's original pancreas. So they can still produce the insulin, they can still get the patient the effects of having a pancreas, but they're less susceptible to that damage. So that's just one example of something that I've kind of been, keeping my eye on, because, type 1 diabetics, even the guidelines that are in place there in traditional medicine, I think they are not quite optimal. These patients are going to have really high rates of heart disease, kidney disease, vision issues. And this is something that holds real promise, because it's not something where it's like, oh, you have to program this every day. It would just sort of be sitting there doing its job, just like your pancreas should be.
You had touched upon a low-hanging fruit several moments ago, and you said sunscreen, which, and you also mentioned it's pretty controversial, which strangely enough, it is, along with most topics, because like people will say become like vigilant with your health, become vigilant with your politics, like don't trust anyone. And yet there's when you do find time to dive into any of these topics in life, you find such convincing, conflicting information. I have pockets of friends that are extremely convincing that, certain sunscreen chemicals, which we know are carcinogenic, will obviously become or could become systemic and cause cancer. But then if you don't use it, you look like a wrinkly prune, not good either. And then like the natural stuff, like the zinc, you look like Casper the Ghost when you walk outside putting the natural stuff on. So for people that are especially in hot areas or people that are on vacation, like what is the right thing? 'Cause you said it's a low hanging fruit, but I think a lot of people, including myself, are confused on what is the best way to handle sun exposure.
Yeah, and the way I approach it is I don't worry too much about exactly what's in the sunscreen. It's like if there's a choice between like using a sunscreen and not knowing what's in it
Mhm.
versus going and not knowing what's in sunscreen and getting sunburn,
Yeah.
then generally I'm going to just use that sunscreen regardless of what's in it. As you mentioned, the zinc oxide, the zinc containing sunscreens, those tend to be the like safest on paper, because they're mineral based, they're reflective. But then you have the issue of the aesthetic of it, right? So everyone wants to like, wear sunscreen, but not look like you're wearing sunscreen.
Right.
Not just look like you took a paint roller down your back, that sort of thing. But yeah, the zinc oxide, titanium oxide, those sorts of ingredients. I think the titanium is a little bit better in terms of the aesthetic, but it goes back and forth. I see experts on one side saying that, well, these amounts are so small. It's like, yeah, when they're doing these toxicity studies in animals, it's going to cause problems. And anytime you're looking at carcinogens in mice, you're going to see an exaggerated response. So that the top two causes of death in a lab animal, number one is euthanasia because they will end their life before they develop these tumors at the end of their lifespan because it's a pretty brutal, gruesome thing. And then number two is going to be cancer if those mice live long enough. It's not like us where we develop cardiovascular disease much earlier or much more often, but it's these carcinogens. So this, you see this with the aspartame studies, I believe, where they, fed these mice like their body weight in artificial sweeteners, and they're like, oh, look, they got tumors. I was like, yeah, that it would have happened anyway, and it was probably unethical to let those mice live with those severe tumors just to get a picture and drum up some headlines. So I don't worry too much about the sunscreen. To be honest, I don't have like a PhD in this specific field, but I think that the evidence is pretty clear that like the small risk of using the sunscreen and the unknown there is definitely like going to outweigh the risk of getting cumulative sun exposure, certainly from an aesthetic cosmetic standpoint, but also if you're looking at things like skin cancer. So good population you look at, like these, like where I'm from, Southern Illinois, lots of cornfields, lots of farmers, 60, 70, 80 years old at this point, didn't either have access or haven't used sunscreen. And now they're, having all these different skin cancers taken off areas that were exposed to sun over many, many years. So that's sort of my take on it. I don't have the perfect answer there. And, there's always an option or a possibility that you'll see something there that, was harmful and they'll say, oh, yeah, we should have, we need to switch this ingredient now. Just like you see, like in water bottles, right? They're all, BPA free. And, there's question about like whether those new plastic polymers that they're using are benign. And, I think that the industry is always going to slightly outpace whatever safety measures that regulatory bodies can put in place. And the takeaway that I have is the best thing you can do if you're being exposed to a health hazard is exercise and eat the best foods you can. So if you're not getting enough sleep, you better be exercising and eating healthy. If there's something in your water supply that's bad for you, better be eating healthy and exercising. That's kind of the default that I have. It's like, well, there's all these things that we could spend so much time worrying about, but just kind of focusing on, what can we reasonably do to push back against some of those risks?
It does feel, the deeper you get into these topics, the more you realize you could do. I find that every podcast, whether it's like yours or Huberman that I listen to, I'm like, jotting down a couple notes or something. And my protocols have gotten like ridiculous. And my supplement like cabinet is just overflowing. And each time, you hear, this new supplement, and you hear like several experts say this particular supplement. Okay, if I hear 5 different experts that I trust say it, okay, I'm going to add it in. And things get more and more and more complex. But not everyone is obsessive and OCD like that as I am, or perhaps you are. And for people, let's say like certain relatives of mine that are extremely the opposite, that don't necessarily put any effort into these types of things, are there a few things, people listening, that maybe if they're not in the best shape, or not in the best health, or they have certain concerns, what are some other low-hanging fruits? What are some best bang for the buck type supplements or routines that they may not have heard of? Like, we all know sleep, we all know drink water, we all know you're supposed to exercise. What are some other things that would be very easy to add into that everyone should or could do?
Yeah, and we get this sometimes. Like, I'll have a new patient come in and they've got a list of like literally 3 or 4 dozen supplements, and they're like, yeah, I've just kind of added things in over the years, and now like I'm not sure what I should be taking or shouldn't be taking. And then my question is like, okay, let's go ahead and like do some homework here. Let's see what is each thing that you're taking for, because there's some things there specifically that you said, aha, I've noticed the benefit from this, or I'm taking this for this. And if there's things that you're taking just to be taking and you don't know exactly why, a lot of times we'll just start with a fairly clean slate. So we may leave in like, if someone's on some creatine, which is one of those sort of low hanging fruit, or if someone's taking some, omega-3s, with a lot of people, I actually switch them over to the omega-3 ethyl esters, because they're pharmaceutical grade. That's a prescription. And actually Mark Cuban's Cost Plus Pharmacy, it's the cheapest place that I've found people can get them. There's something like 17 cents per capsule at the time that we're recording this. So I think he's done a lot of good in getting people, affordable medications. And then we'll test and see, okay, are you even somebody that maybe needs to supplement with omegas? Because some people will incorporate a lot of omega-3 into their tissue and into their red blood cell membranes where we're measuring it. So they may not even potentially benefit much from the omega-3s. And then other people are going to have to take very high doses to get that omega-3 index above 8%, ideally around 10 to 12%, something like that. But other low-hanging fruit that people may not think of, assuming that you've got all the foundational things right. So you're eating a reasonable diet, you're exercising a reasonable amount, you're getting an adequate amount of sleep. I guess like if someone is overweight or obese, getting a screening test for sleep apnea, especially if you snore, is kind of a low-hanging fruit. So like the biggest biohack for them would be like a CPAP machine, if they do in fact have sleep apnea, which is probably about 1 in 4 in the general population at this point. A little bit more common in men, but that's kind of what the numbers seem to point to. And sleep, for me, I've introduced a sleeping mask sometime within the last year. The data on like not getting even low-level light into your eyes at excuse me, at night seems particularly important. So I saw like people use sleeping masks. They were more alert the next day. Their sleep quality was better balance between the sympathetic, parasympathetic nervous system. I'm like, okay, I'm sold. You can get a sleeping mask for $10. You want to get a fancy one, maybe you're looking at like $50. But really, any mask will do the trick as long as you're not a super restless sleeper and ripping it off in the night, that sort of thing. I guess supplement wise, creatine I think has very little downside. Maybe we would stay away from something like that if someone does have chronic kidney disease, but even the data to suggest, not using that there is kind of shaky. Like there's one study that people point to where it caused a decline in kidney function, but this was also in an HIV patient who was taking the antiretroviral therapy, also taking other, workout supplements, protein powder and creatine. And they actually went and did a imaging study to see like, okay, how much blood are these kidneys actually filtering? They're like, well, it looks like what we're seeing on the test doesn't match what's in the blood work. So it was kind of an ambiguous result. So we tend to measure like a cystatin C over the creatinine for kidney function specifically. So this is a test that is very cheap. People can ask for this. It's one that if someone exercises, has more muscle mass, takes creatine, eats a lot of protein, you really should be checking a cystatin C over that creatinine, because it'll be elevated, but it's sort of a false marker of declining kidney function. I think omega-3s are generally good. I think protein powder technically is supplement. I guess you could call it a food too. If people have a hard time meeting a reasonable target, which I'm not as aggressive with the protein intake as I think some people are out there where they're like, oh, you've got to have a gram or a gram and a half per pound of body weight. I'm happy if people are getting about 0.75 or 3/4 of a gram per pound of their body weight. Especially when people, if someone's 250, 300 pounds, they don't have as much lean mass to support yet. We're working on bringing up that lean mass, pushing down the body fat. So I guess that's sort of a long-winded and all over the place answer, but those are some of the interventions that are my, I guess, go-tos, or things that, people are not necessarily doing that could be pretty easily incorporated in. And I think the positive about everyone, wanting to take supplements is now that can be a catalyst for a lot of other positive changes. So people are very interested in their health, which I think is a great thing. And if someone starts taking a supplement and then they exercise because they're taking the supplement, they want to get the most out of it. I see that as a win-win.
You had mentioned creatine, and I am someone that has been confused on creatine because I've heard from several, we'll call them major podcasters, said that there's definitely a benefit to creatine, but also your hair could fall out, which kind of I heard and I was like, oh, I don't know about that. So do you not think that? What's your thoughts?
I don't think so, at least not through the mechanism that is like speculated there. So there's one paper at this point where it looked like there was a rise in DHT, dihydrotestosterone, which is the downstream metabolite of testosterone, which is definitely contributory to androgenic alopecia or male pattern baldness. Not everybody is sensitive to that. Most of us are, into different levels. So does creatine raise that reliably? I haven't seen it in the anecdotal blood work from my patients. And especially if someone is taking something to reduce the DHT. And we've seen this like before and after where, it may move just with natural fluctuation a point or two. Like DHT goes from 16 to 17 if someone's taking finasteride and using creatine. But I think there may be where some people are sensitive to this, just like someone can take a blood pressure medication and they lose some hair from that. They have some shedding. It's like, well, there's not really a mechanism there. It's not raising DHT, but hair loss is a side effect of a lot of medications. So I think it's the same way with, creatine, because when you look at supplements, they really do behave like medications. You just have less data on them, as far as what could happen. So do some people take creatine and lose hair? Probably. I'm not going to point at them and say, no, you're a liar, it's something else. But for the majority of people, I think it's a little bit overblown. And for most people, I don't think it's going to cause like a significant raise in DHT or a significant amount of hair loss.
Okay. So I'm going to ask you a couple of things that no matter how many podcasts I listen to, I can't get a straight answer on. Are you ready?
Ready.
So the first one is, so I've listened to David Sinclair, I've listened to you guys, listened to Huberman, to Tia, you can go on and on. When I'm working out or in the car, I'm listening to this stuff, and I never can get a straight answer on children's health protocols. I hear a lot of stuff that's very specific towards adults. I have 3 little kids. I want to raise them in the most healthy way possible. I try to do that with the information that I have, but I also know that kids' nutritional needs are much different since they're growing much faster and they're in a different phase of life. Can you touch upon something that no one has ever really touched upon from all the podcasts I've heard, how children's nutritional or supplemental or any other type of protocol, how their needs may differ from the standard advice I might hear from someone like yourself on your podcast? Like, how does it differ? What can I do, if anything? What can I do differently to make sure they're getting everything they need in the right amounts?
Yeah, so I think the biggest issue in sort of the children's public health space, or for most children today, is that I guess if you compare today to like the 1970s, there's this abundance of nutrient poor food as opposed to the nutrient dense food. So, having Captain Crunch for breakfast, nothing against that cereal in particular, but it's not going to be a great source of nutrition. So even though you see the label and it's like, 13 important vitamins and minerals, I don't think people are fooled by that. Realistically, people know that that's not a foundational, healthy breakfast. But it's what is very palatable for kids. Kids are going to choose that over something like eggs every time. So sort of the core principles I would look at is how can you get in those like very nutrient dense foods, which for most kids are going to be a combination of, like you say, like an animal-based diet or a plant-based diet. And my answer is like, well, why not both? In terms of just maximizing the amount of, B vitamins, trace minerals, flavonoids, and phytochemicals from the plants. You want to have them eating as many fruits and vegetables as possible. And then, a reasonable amount of, protein and dairy products and things like that. They're going to promote growth and optimal, brain development. Looking at things like, their iron status, especially for like, I guess this is moving into like the adolescent years. Like for women, females that are going to be athletes, they're going to be, losing some iron from menstruation. So a lot of them are going to be iron deficient, have no idea. If you look at like the average like girls cross country runners, they're probably going to benefit from some iron supplementation. Because they're going to restore their iron, they're going to get a bit better oxygen carrying capacity of their red blood cells. You'll see the run times go down. So I think when it comes to like, supplementation, a multivitamin is something that probably not needed in every case. But if I looked at the population average and, someone's not eating, a pound of fruits and vegetables per day, kids or adults, like they probably could benefit from a multivitamin or even half a dose, because I think at worst it's going to have a neutral effect and it may have a small positive effect. Now, you're not going to get the flavonoids, the phytochemicals, those sorts of things from the multivitamin, but you'll be covering your bases in terms of those, essential vitamins and minerals, so that kids aren't having a B vitamin deficiency or an iron deficiency, these sorts of things. And I think as hard as it can be, like kids and blood work and kind of measuring these things over time, no kid wants to go to the doctor and get blood work, but doing that on a regular cadence so that you're not missing things. Because, in my world, I'm doing, only things with adults. It's more of an internal medicine practice, but so I may be wrong here. But my perception is that there's not a lot of blood work that is done for children. Like for myself as a kid, I remember, getting the shots and vaccines and that sort of thing, but I don't remember a lot of blood draws. So things may have changed there, but my perception is they're probably just checking some basic things. Okay, kidneys, liver, lipids, maybe CBC, making sure they're not anemic, they don't have leukemia, these sorts of things. So some more like extensive blood work. Of course, we're not going to try and do like 40 tubes because the children don't have the blood volume to support that. But something that's a little bit beyond your standard test. So you can even look at some genetic things that are not likely to change. So I think like in adolescence, if someone gets a lipid panel and they realize, hey, I've got FH or familial hypercholesterolemia, that could be an important piece of data that could really steer how that person manages their health when they're 18, 20, and so forth. And they start to, you plot them on the timeline and say, hey, the odds are you're going to have a heart attack before you are 50. You should probably be taking this medication because you have this genetic predisposition to have a heart attack, because now we know we can prevent that. Whereas there are cases where, I've seen people, they like, nope, I haven't been to the doctor since I was 20, 40 years old. They get some blood work and they've had this like sky high, it could be a total cholesterol as high as 500 or 600. And they just had no idea for the last 20 years.
Okay. So aside from like a multivitamin and eating healthy, which we definitely do, there like probiotics or omegas or other types of things, should we be worried about that as parents to make sure they're, let's say all their foundations are met, which I think my kids are, we're pretty health conscious. Are there things above that foundational level like omegas, probiotics, or certain supplements that I should be looking at, or am I looking at this too concerned and there's too much of a worried dad right now?
Yeah, I think omegas are reasonable. Probiotics, I can sort of take them or leave them. There's a lot of unknowns about gut health. We know that gut health is very important, but when you say like, how do you improve gut health beyond foundational things, it's not exactly clear. So like if let's say a child goes on a antibiotic, probably a good idea for them to take a probiotic concurrently with that. I mean, one is going to prevent stomach upset to some degree. It's going to prevent things like diarrhea, bloating, stomach pain. Not 100%, but to some degree. And it should help them to preserve and build up some of their microbiome faster than having it wiped out and then taking several months to recover. But things like exercise can improve the gut microbiome very quickly. Aerobic exercise, 6 weeks, you have more diversity. Same thing with fiber intake. So, whether that's in the form of a fiber supplement or foods that contain prebiotics like inulin. One of these is like onions. That's probably the biggest source of the inulin specifically in my diet.
Okay.
That's something that's going to go downstream and help to sort of feed and nourish the gut microbiome that's there. So if you're doing those foundational things, I don't know that many people are going to benefit from adding in a probiotic. Now, if you have someone where they have a, sort of a, an IBS of sorts, where either they're, getting constipated, or having more diarrhea, that could steer my opinion there stronger. If someone is constipated, you probably don't want to add extra bacteria to that because they have a slower transit time, and you could put them at an increased risk for something like SIBO, so the bacteria overgrowing and backing up into the small intestine. Now, if someone has more rapid emptying, more prone to diarrhea, this happens, kids have stress and things, then it may be reasonable to try and add in a bit of a probiotic to, fill that. But really you're looking at, okay, what's causing this stress here? Is this something that's transient? Because we always want to do something, right? Like if I have a patient and they have a problem, or I assume, as a parent, a kid has something going on, you want to do something. But sometimes these things are self-limiting. So just like if someone has a little upper respiratory infection, they want an antibiotic, but, in reality, it's not going to make much of a difference. They might feel better for a day or two because it's a little bit anti-inflammatory, but basically 5 days, 10 days from now, there's going to be zero difference on the actual outcome. So, I think having the foundational things, plus or minus a multivitamin, plus or minus omegas, probiotics, I don't tend to do those a whole lot unless it's alongside an antibiotic, or if someone just genuinely feels better. They're like, yep, my digestion is better, my mood's better. There's a lot of sort of crosstalk between the gut and the brain at this point. So there's cases where if like someone has tried that, it's like, okay, yeah, if it's not broke, don't fix it. If you feel better on it than off it, probably not a lot of downside to that.
Another thing that I find a lot of contradicting information getting thrown at us as like the audience listening to a lot of these YouTube channels or podcasts is things like nutritional information, let's say, nutritional practices, carnivore, plant-based, all these different things. That I'm going to throw two things at you. You pick whichever one's more interesting. Also, like a lot of longevity protocols I'm very interested in, like the stuff that David Sinclair puts out about fasting. I try to do personally, I try to do like a 14 to 16 hour intermediate fast for longevity and health purposes. But then also in the same breath, they say how important building lean muscle is. And then you hear, I hear and learn that obviously to build lean muscle, what do you need? More food. So it's like a lot of contradicting stuff. Like one expert that is very well respected is saying, you should fast, maybe eat like one meal and shove it all in one meal and then exercise. And other people are saying to build lean muscle, you have to eat like 4 or 5 meals a day, get your protein, like you mentioned, at least like 0.7 or 1 grams per pound of body weight. It's like, okay, well, how do you find the balance between building and gaining lean muscle with potentially fasting to make yourself live longer and be healthier and build your immunity and et cetera? How do you as a medical practitioner and someone that's interested in health, how do you find that balance between the different experts that are saying things so convincingly well from all these different areas of the internet, let's say?
Yeah, and it can be very confusing for people because it's the most extreme opinions and voices that are being put out there that get the most attention, versus someone who's just more reasonable saying, hey, at this point, the My Plate guidelines are not all that bad. If we look at sort of a breakdown of what people are being told to eat and then what they are actually eating, about the only thing that people are eating that has nutrient value is meat and eggs at this point. That's about 60% of people get a reasonable amount of like meat, eggs, dairy products in their diet. And what people are not getting a lot of, this is 80 to 90% of people are not meeting the recommendation for intake of like fruits and vegetables. So the fiber intake is 10, 15 grams per day is what the average person is getting. They're barely getting a serving of fruits and vegetables in per day. So we to the question, plant-based versus animal-based, my personal diet and the approach I would take is, pick your favorite things from each category, as long as you don't have, moral concerns there or reasons that you're, not going to eat animal products. And then, figure out what works for you. I recommend people use the Chronometer app. I don't know if you're familiar with that one, but you can
Write that
scan
down.
different foods, put
Okay.
different foods in, and it'll tell you like what the B vitamin content is, how much vitamin C you're getting, how much zinc you're getting in your diet, and then you can sort of build out what's going to hit the 80% there. So you don't have to have like 100%. You don't have to be eating the same things day in and day out. I tend to eat a lot of the same things, like, my breakfast, lunch, and usually my dinner are very similar, just because I know, like, okay, I know this is what the calories are that's in this. I know I'm hitting my protein. I know I'm hitting, 80% of my micronutrients, and that's pretty good. And that works for me. But some people like, a lot of variety, and they can hedge, with a multivitamin, so that they are for sure getting those, B vitamins and so forth. And then I guess on a bigger scale of question about like, nutrient timing, or whether fasting is better for longevity or building muscle is better for longevity. If I could put this on a time scale, it would probably be like early adulthood. So someone is, 18 to 30, 35, you're building up your lean body mass there. Like, so once you reach that optimal level, so let's say someone has a BMI of, let's say, 24, body mass index is 24. So they're kind of bordering on overweight, but they have a significant amount of lean body mass. Maybe their body fat is something like 12, 14%. At that point, it may be reasonable theoretically for that person to dial back on, protein, because I don't need to continue to add lean mass, get to a BMI of, 25, 26, 27. At a certain point, you hit a threshold and you're just going to add extra fat tissue. So then during, let's call it middle age, something like 35 to 60, it would probably be reasonable to incorporate, some fasting, maybe even some, not necessarily protein restriction, but methionine restriction. And that is only out of the preclinical, like the mice data at this point. So I can't say definitively that, restricting methionine in middle age is going to do anything beneficial in humans. But, as long as you're hitting your protein, it's probably not going to be harmful, assuming that you already have this, optimal level of lean body mass. You can maintain that much easier than you can build up to it. So that's why I sort of think of early adulthood. Yeah, you've got your foot on the gas, you're trying to build up, get that lean body mass there. And then you're sort of cruising through, middle adulthood. Maybe you're doing some fasting, maybe you're doing some protein restriction. And then when someone hits, 60, 65, you start to really see the, speed of sarcopenia or muscle loss accelerate. And at that point, you probably pivot back more towards prioritizing the lean body mass. Assuming that you've maintained a pretty good foundation, you're still going to start to see a little bit of loss around that age. So you want to pivot back towards, okay, I need to, focus on protein again now, not necessarily worried about fasting or methionine, these sorts of things, because you want to preserve that lean body mass that you do have. So that's sort of the way I look at it. Things that are, good for us when we're young aren't always, the best for us when we're old. You kind of see this bimodal data when we talk about things like mTOR activation and some of the animal models. Seems like it may be detrimental if you do that very early in life, whereas at the end of life, seems like you have this sort of hyperfunction of cells, and putting the brakes on that seems to be helpful to some degree. So that's sort of the way I look at it. Big picture is that there's different ways to eat based on where you're at in life. And unfortunately, most of those people that are in that sort of 35 to 60 category, they don't have enough lean body mass and they have too much adipose tissue. So, we're pulling weight off and trying to add lean body mass, playing catch up. But if somebody spends a couple of years, gets their lean body mass optimized at 40, then yeah, it could be totally reasonable to, add in some fasting, maybe some methionine restriction. The global protein restriction, I suppose if you could maintain the lean body mass on, 0.5, grams per pound, then I don't see how that would necessarily be harmful, assuming you maintain that lean body mass. So that's kind of the way that I look at it in theory, based on what is out there. But then also thinking about, okay, what is most of the population actually like? Not necessarily mapping out their, next 60 years of nutrition and so forth.
I'm very much the same. I pretty much eat the exact same things every day just to make sure everything's like met. I'm very boring. I'm like Dr. Spock when it comes to that kind of stuff. I just want to make sure everything's like met, especially with my morning shake. Just put everything in that I possibly could that can meet every criteria. Are there, James, are there health protocols or practices or supplements or anything along those lines that gets made fun of so much on the internet, but actually deserves some attention and some respect in your mind?
Yeah, I would say the one here, and maybe this is where I've shifted my perception a little bit, is breath work, because it was kind of
Okay,
like this,
interesting.
even I thought probably 5 years ago, this is, hippie stuff. There's other ways to manage your stress. It's like, yeah, like there's data on yoga and this, but I thought that was, strictly just coming from the, like, people are being active and moving and balance and those sorts of things. But as more and more of these sort of papers have came out, and then looking at, the way the military, I believe it's like the SEALs will use this like square breathing, for example, to kind of maintain a state and not get into too sympathetic of a nervous state, not to get too overstimulated. And then things like the Nature paper that came out recently with that sort of double inhale that I know Andrew Huberman has talked about, and now seems like everyone else is sort of regurgitating that. This was something that I thought was like, yeah, breath work, take it or leave it. Like if it makes you feel better, do it. But I think there's some evidence there. I think this was something previously a lot of people were sort of making fun of, like, oh yeah, breath work, this or that. But there is some data there. I hear people talk about doing it in the morning a lot.
Mhm.
And to me, this is a little bit puzzling. I suppose if someone like wakes up with some anxiety, they're sensitive to that cortisol, and the catecholamines get kicked out by the adrenals, then that could be a reasonable approach. But for most people, the morning time is when they're going to be the calmest. So if you're going to do breath work once a day, it probably makes sense to do that in the evening when you're kind of trying to wind down. Typically, your heart rate variability is going to be lower in those evening hours, and then of course, it recovers as you sleep, and it's higher in the morning. So the timing there, people are like, oh, morning breath work. And to me, I kind of think, okay, maybe if you have like stress in the morning, makes sense. And certainly not harmful to do it twice a day. But if you're going to pick, like, you only have so much time in a day, right? And I think the thing that gets made fun of now is these people with like a 4 or 6 hour morning routine so they can get optimized for the day. So it's
Right.
really just picking what is the best startup for you, right? So ice baths, that's something that I don't do personally. I don't know that there's a lot of like health benefit to that necessarily, but people will feel very good from that, and then that can have some downstream positive effects. So does everybody need to be doing ice baths? Probably not. But if it makes you feel good and you don't have like cardiac risks where you could flip into an arrhythmia from doing an ice bath, then it's probably a reasonable thing to incorporate, as long as the benefit you perceive from that is greater than the sort of time commitment and the negative of it.
I'm going to ask you something that is you can opt out of answering, and you don't have to go into detail. You could just say like yes or no. But um, the way the world is right now, it's very divided. There's a lot of topics. There's a lot of things that we're not supposed to talk about. I guess you can. I'll ask this in a way that'll let you answer with a yes or no. You don't have to go into much deeper. But is it something that concerns you or is on your mind off air? Let's say in your own personal life, how it seems like politics and ideologies of any sort influence your field of work. It seems like from both sides of the aisle that politics and certain things that should have nothing to do with what you do has more of an influence than it should. I'll leave it there. You can take it or leave it, whatever you want to do with that.
Yeah, I guess I'm somewhere in the middle. So it's not that I'm, totally oblivious to it, don't care. It's not something that I, stay up at night worrying about. But
Mm,
as far as I guess the way that the world is functioning, if you take, I guess it's sort of politics, sort of business with traditional medicine. You have these practices that end up getting bought out by venture capital, and then basically they're looking at, okay, how can we like make this profitable again? And typically that's going to be more patient visits in a smaller amount of time. So I saw an article that said the average doctor's visit is like 7 minutes at this point. So your appointment's maybe 15 minutes, but you go in and the nurse gets your blood pressure, asks you if you have any questions, goes over the medications you're taking, and then it's a very small window of time that you're seeing that doctor, and then they're going to bill insurance, like $400, $600, something like that. So if I were in the traditional environment, I think I would probably be, more concerned about that. As far as the, the politics of certain things, I'll say that it was, it's a little bit interesting. And I followed this closely because I was working as a house supervisor at a hospital in Indiana whenever sort of I'll say, respiratory condition, because I'm not sure what words are flagged, but anyway, when that came about, March of 2020. And, it was really interesting because, you would have people, talking about things, and you'd have people on both sides, right? So this whole thing between like, the origin and, what is and isn't allowed, it's interesting to watch, and I don't think anybody knows the full story as far as anything really. You see differing viewpoints, differing experts on both sides. And unless you yourself are an expert in that field or have a lot of insight and a lot of research time put in, then it's very difficult to keep up with. So I think most people's energies are, best spent elsewhere. And I think there's going to be sort of a return to the mean at some point. So I think we're at sort of an extreme now, with these, the algorithms that are going to put up the most like engaging content, right? So I think what you see on social media and in the influencer space is probably a bit of an exaggeration. I don't think most people actually have that much of a difference in value. Like just because someone disagrees on 1 or 2 points with another person doesn't mean that they don't have anything in common, which is what, the internet would leave you to believe.
Right.
But if people go out and, talk to their neighbor, you talk to somebody at the grocery store, you talk to your friends, I don't think people have all that differing viewpoints. Certainly there's exceptions and people can agree to disagree, which is kind of contrary to the message that's put forth there. So I don't know if that directly answers your question, but it's sort of an indirect way and just a little bit of sort of my take on, the big picture and those things that I do think about a bit.
Yeah, I definitely think about it a lot. I didn't want to bait you and pull you into something that you weren't willing to dive into. So that you take that wherever you wanted to. It's all good. It is interesting, is what I take from that. It definitely, we're living in an interesting world, and people are it just goes again to show that people are just not agreeing. And not only are they not agreeing on stuff, but you don't know what to agree on and what not to. You're getting such conflicted information that people really have been kind of forced, whether it's health, politics, society, economics, whatever the topic, people really are sort of forced to either blindly lead your life in any of these topics or become very, very vigilant and spend a lot of time trying to weed through everything and figure out which things make sense to you and which is true, which is not true in all these topics of life. And it's overwhelming. Speaking of which, I'll have a couple more questions if you have time, just a couple more. I don't want to take your whole.
Absolutely.
AI is something that really interests me, and I'm wondering what your take on it is, not only on the topic of will AI sort of take over your profession, but also from a scientific and medical standpoint. Like, when do you think, or if I guess, when or if AI will get to the point where you can just sort of type in cure cancer, boom, there it is. Like, is AI, are you already seeing things that are giving you hope or fear where we can use AI to kind of solve very complex medical or scientific problems that might have normally taken us maybe a couple hundred years? Like, where are you seeing this?
Yeah, so there are AI and machine learning algorithms that are already incorporated into health systems and health technologies. There are other areas that is trying to be incorporated, and it has not necessarily panned out. A really interesting story about this. A colleague of mine, Dr. Taylor Martin, who I did an interview with on the Gillette Health podcast. I'll probably butcher this story to some degree, so you can go check that out if you want to get the full scoop. But essentially, he was working with a group, and they were trying to program an AI that would be able to screen out chest X-rays for tuberculosis, I believe it was. And they, had this machine learning algorithm, looked at all these different images. This is what a positive test looks like. This is what a negative test looks like. And at the end of the day, what happened was that AI was picking what was negative and positive based on the type of X-ray machine that was being used, not the actual image that was there to be analyzed. So you have things like that where it's like, oh, we've got a really good idea that could improve efficiency. And there's always going to be some degree of like a human checkpoint. I think I don't think it's going to be running loose and you're going to have a robot doctor with no sort of hard stop there. But a good example of what is actively being used, something that I use in my practice, we use in our practice, is the Clearly Health AI analysis of when someone has a CCTA. So CCTA, they put an IV in your arm, you shoot some dye in there. Sometimes people have an elevated heart rate, take a medication to slow it down so you can get some really good quality images. And you're looking actually at the blood vessels that supply the heart oxygen, so the coronary arteries. And you're going to see, is there any plaque there whatsoever? So people may be familiar with getting a calcium score. That will pick up advanced disease. It's got a pretty decent, 5 to 10 year like risk prediction potential. But it doesn't tell me if there is some soft plaque there. So if you have like a 35-year-old, even a 45-year-old, it's not a great test for them because it's not going to pick up things that aren't advanced or haven't been there for a long time. So if someone has a calcium score that's positive below 45, that's very alarming. But a lot of times people were getting a CCTA and kind of plotting where they're at on the type in their lifespan. They have this much plaque at this age. So if someone has a 25% stenosis at age 30, that's a problem, even though their calcium score is 0. And then what we can do if we have one that's kind of in this indeterminate area, you submit the CCTA imaging too clearly, they can run an AI analysis and determine, based on their machine learning and looking at, they sort of train these. I'm not sure exactly how to describe it, but they train these models based on, okay, what stabilized plaque looks like, what unstable plaque looks like, because there's huge databases of these types of imaging tests. And then that algorithm can look at your patients or your personal CCTA and say, hey, you've got this unstable plaque here. This looks pretty bad. And then it can sort of classify, instead of moving from instead of being at a yes or a no, like you have heart disease or you don't have heart disease, now they're moving towards a staging where it's like, okay, you have stage 1 coronary artery disease, or stage 2, or stage 3, or stage 4, or stage 5, and so forth. So it's sort of being recognized now as a progressive disease that starts early rather than something that happens to old people. So as far as the AI, that's something that is in use now that has a lot of clinical validation. And then there's other ideas that are trying to be spun out there all the time. And people will throw around the word AI and machine learning a lot in marketing because they're buzzwords. But if you're looking at something and it has a like in health, let's say it has a population where it says, oh, we analyzed hundreds of patients and then we have this machine learning AI algorithm that we feel is very well validated. Like, that's really not a large enough sample size. It's going to work really well for those 100 patients if you run those images back through. But if you apply it to a more broad population, it's not going to have very good sensitivity or specificity. So you really have to train these things on large like biobank data where you have tens of thousands or hundreds of thousands of pieces of data that are fed through there on many, many different individuals in order to get something that's going to be clinically useful and able to pass validation testing into the broader sense of like a population level. Another example of this is the Grail-Galleri test, which is a multiple cancer early detection is kind of how they've termed it. It's a blood-based test, and they've done the same thing. They trained a machine learning, an AI algorithm that looks at people who have had cancer and what the methylation patterns on those cell-free DNA that are shed in the bloodstream look like, and what a blood sample that doesn't have cancer looks like. So when people have a tumor, let's say, it's going to be very metabolically active. That's why you see cancer patients become cachectic, lose a lot of weight, lose a lot of muscle mass. The tumors are very metabolically active, and because of that, they shed a lot of this cell-free DNA into the bloodstream. So you can pick up that cell-free DNA and be like, okay, yeah, there's cancer somewhere. But then what do you do with that data? So what they did was they trained basically these methylation patterns. Like if you have a liver cell that's expressing itself as something that is not a liver cell, that's what they're picking up. And they can say, okay, with about 80-90% accuracy, it looks like the point of origin for this is the liver or is the pancreas. They're pretty accurate for GI, gastric tract cancers, less so for things that are less aggressive, like a renal cancer, thyroid cancer, prostate cancer. Not going to catch a lot of those types with this test, but for things that are more high risk, like ovarian cancer for women, you can catch a lot because it's sensitive for those that are more aggressive.
Wow. So I want to ask you what your protocol, what does your day look like? You're someone that is so deep on all these different topics that I can't imagine the menu of options you have in front of you as far as what's floating around your brain, like all these different protocols, practices, tools, resources. What does your day look like? What are things that you definitely incorporate?
Yeah, so I have, I guess, sort of a morning routine. I'll exercise usually once per day. Some days of the week I'll train twice per day, a mix of like some lower intensity aerobic work and some weight training.
Okay.
Which for a long time I had neglected aerobic work. I thought, oh, I don't need cardio. I just want to, lift weights and be a gym bro. Cardio is hard. But then, as I became more and more knowledgeable, I thought, oh, well, yeah, neglecting my heart health is probably not a great idea. So built into my day somewhere is at least I may have one rest day once in a while, traveling, visiting family, and those sorts of things. But most days I'm training, once or twice, and I have a pretty consistent breakfast. Right now it's my wife doesn't really call it a breakfast. She's like, you're just eating random foods, which is kind of funny. But I have a couple squares of like dark chocolate, and dark chocolate, I mean like 85, 86%, not like 60% dark chocolate that's full of sugar. I have, a handful of nuts, some boiled eggs. And then that's my breakfast. I feel like, I tend to avoid those carbohydrates with my breakfast, the exception of maybe some frozen berries on some days, because I feel like, having a lower carb breakfast like sets me up well. I don't feel like I have any kind of a blip in my like concentration or energy levels. And it sets me up well for the day. Depending on how early I get up, like this morning, got up 5 a.m., did a set of resistance training. So probably this afternoon I'll do 30 minutes on the bike or something like that. Very low intensity, just hitting a heart rate of 120, 130, just sort of keeping that aerobic foundation in place.
Mm.
I do have coffee, usually 2 servings of coffee, so about 200 milligrams of caffeine um, every day. I cut that off before noon, otherwise it does impact my sleep. And then my lunch pretty consistently has been grass-fed beef, grass-finished beef tacos with avocado incorporated in there, whole grain tortillas. I'm not afraid of grains personally. I know some people don't do terrific with them, but for me, it's a good way to get some complex carbohydrates in, get some fiber in, and then having the fats that are in there and the avocado helps to slow that digestion. So I'm not getting a big, glucose blip there.
Mm.
I think it'll be interesting for most people to wear a CGM either for just 14 days or for a month and see like how they respond to different types of food, different orders of like eating those foods. So like if you're having carbohydrates at a meal, like if you eat your dessert first, like you're going to see that spike. If you have dessert after lunch, for example, like it's going to be much less pronounced. It depends on your metabolic health, sleep, stress, all these other things. So that's something that I personally found to be useful when I ran that experiment. So I try to focus on, movement, spending some time outside. I really do enjoy, like where we live at now, we have birds in the backyard. Ourselves and the neighbors all have, bird feeders. So it's nice to go out there, hear the bird song, kind of be not grounding in the sense that I'm, walking around in the yard barefoot, but grounded in the sense it's like those nature safety signals. I think they resonate somewhere in the reptile brain in there.
Yeah.
So kind of helps bring me back down. And then I find that useful anyway. Sleeping mask is something that, like I said, I do incorporate that. As far as not getting down like a path of I'm taking 30 supplements, I kind of have a hard stop built in for myself where I have these medication or supplement, just I guess it's like a tackle box is what my wife calls it, but it's like a pill organizer.
I have the
And
same.
I'll line those up a month at a time or 28 days at a time so that I'm not making more than one change every month. Because otherwise, I'm going to throw in a ton of ingredients, a ton of supplements, take things as needed, and then be like, okay, I made 6 changes last month and I have no idea what worked or what didn't work.
Right.
So when I'm kind of, at my cadence there, once per month, I might, change something for a subjective effect or introduce something if I'm looking to see a change in a blood biomarker. About every 3 months is how often I'm getting my personal blood work done. Maybe more often if I'm rechecking just how like something simple adjusted a level. But usually about every 3 months is a reasonable cadence. If I have everything, dialed in and I'm 100% satisfied at some point, maybe I'll move that out to like 6 months. But for right now, every 3-4 months is kind of what my cadence is for the blood work. So I don't really have a clear, like organized, like this is my day-to-day schedule, but I definitely do have sort of a morning routine where I eat pretty much the same breakfast, take my supplements with my breakfast, and then sort of go about my day and make sure that I'm getting in, exercise, spending some time outside, and then of course, working, and then yeah, I hope that gives people some insight information. I don't know how terribly useful that is, but that's sort of just my random thoughts on things that I've incorporated into my routine.
I think it's helpful. I think that a lot of people that don't have such a regimented routine make things more complex than it should be. And I think with a lot of these things, like your routine actually sounds very similar to mine. I have several tackle boxes that I set up like several weeks ahead of time. I just spend like 15 minutes, like once a month or once every few weeks, fill in all the pills day, night. And it's on one level, you can look at these types of routines and be like, oh, you're making things so difficult and complex. But it's like, I think we do these things to make things very easy. Like I am similar in that I eat the same exact protein shake with like 40 ingredients every day. And it's like a ritual. It's enjoyable for me. I know I'm getting all my nutritional needs. And on one level, it's complex and a pain in the butt. But on the other hand, it's like, it's just easy. I just hit blend, I drink it or whatever, eat whatever, and it's easy. So you had mentioned CGM. I believe that's constant glucose monitoring.
Yeah, that's correct.
I want to make sure we specify in case someone's listening and like, what the heck is that? I also use a sleep mask. My sleep routine has gotten very regimented. A sleep mask helps quite a bit. My a weighted blanket I find helps a ton. So I'm definitely with you on that as well. Are there things that I didn't touch upon that maybe you feel would be worthy to add right now, whether it's a topic or whether it's just talking about the stuff that you personally do? Like if you mentioned blood work, and I would love to get blood work done more often, but other than my novice information that I try to research on, a lot of that stuff doesn't mean much unless I sit there and Google each thing. Is that something that you offer as a service for people listening? Like, I'm going to email you my blood work and you tell me if I'm healthy or not. Like, how do people, what are some resources, I guess is the question, in addition to what I just asked you, what are some resources or some tools or websites that normal people can get blood work done and understand what the heck they're looking at?
Yeah, so we have some self-service lab panels that are put together on our website, GilletteHealth.com, and people can go there, and we have these sort of curated to where it's not necessarily a la carte. Like if someone just wants to get a random cancer marker screening that doesn't have a lot of clinical relevance, and then it pops positive for some reason, well, it could be a false positive, it could be elevated because of a liver condition. And then they take that are primary care provider, and there's really not anything they're going to be able to do with that. Right. Now, if someone gets one of these lab panels looking at all the hormones, so adrenal, sex hormones, thyroid hormones, looking at all these different biomarkers, like your primary care provider they're going to know about these things. They may not know exactly, the context and the targets that you would personally have or that I would have for a patient, but they can tell you if there's anything there that's, glaringly wrong. We do have, a la carte consults if people want to order those labs, just have a once over, like, hey, what do you think about these numbers? Is there anything that I need to move, or is there anything I don't need to move? There's examples like, a testosterone level of 300 could be very different than a testosterone level of 900. And there's layers to it, like you mentioned, with the free testosterone and the sex hormone binding globulin that sort of regulates the delivery of the hormone to the tissue. And there's other ranges where it really doesn't matter if your potassium is 4.2 or 4.6, it doesn't really matter a whole lot. White blood cell count, whether that's 4 or 8, doesn't matter a whole lot. There's different sort of baselines that people have there. So knowing which labs are like relevant when they're high normal, low normal, that's something that I think is valuable for people. And aside from sort of the process that you've taken, listening to people that are reasonable, people you've named like Peter Attia, Andrew Huberman, I think they all put out really good information. Listening to those guys and people that those guys have interviewed is a great way to sort of build that knowledge base. And if people want to I guess, expedite that process of understanding their lab work, then, getting a self-service labs of sorts, an a la carte consult would probably be your fastest way to get there. A lot of times we look at, in life in general, the convenience of something. And if you can get convenience and value and health benefit out of something, I think that's a good investment. Whereas a lot of times we look at, things that are more convenient tend to be worse for our health. So like the processed foods, for example, very convenient, not necessarily great for our health. Like your protein shake, I think that's pretty convenient, pretty time saving as a breakfast, and it's a great investment in your health. So I think that's what I put in like a good intervention category. But some of those blood tests that I guess people should be getting, or I think that most people would benefit from checking at least once, seeing kind of where they are. Those are things like your lipoprotein little a, which is a genetic variant of, it's a type of lipoprotein that's thought to be particularly atherogenic. And there are some trials going on now aimed at reducing that number, but they may be 3-5 years away from like getting an FDA approval to like improve outcomes and reduce heart attacks, things like that. Specifically on women's side of things, checking like an AMH, anti-Müllerian hormone. This can kind of plot where they're at in terms of fertility. So you're here at 27 years old. It can tell you whether you have more or less ovarian reserve, and it can be skewed by things like whether someone's on a contraceptive pill. I think that can tend to decrease that number a little bit. So taking into account that, I don't know that's something that someone can do like on their own, but talking with their OBGYN, they could probably interpret as like, oh yeah, you have your AMH is quite a bit higher than average. This is something that would point to you having a slightly longer reproductive window, those sorts of things, because the time that people choose to reproduce, have kids, can be very important. Other things like iron studies, these will occasionally be missed. It may be the case that someone just ends up with elevated liver enzymes, have some iron deposits in the liver that manifest when they're 40, 50, 60, but in reality, they've had these elevated iron levels since they were in their 20s, because a lot of us are carriers for these HFE hemochromatosis genes, which were advantageous, like back in Ireland, like for me, whenever the ancestors were just eating lots of potatoes and not a lot of dietary iron, it was beneficial to hold on to that iron. And now with a lot of iron fortified foods, these people that have these mutations are going to build up iron much more rapidly, and it can cause problems later on. So definitely one of those things you want to catch earlier rather than later.
So you're talking about all these different protocols and different routines you have. I'm like, well, I'm asking this for a personal reason. Does your wife think you're nuts for all this stuff?
No, I don't think so. She's actually
My
a
wife
nurse
keeps
as
like,
well,
my wife,
so that helps.
my wife keeps like
Um,
looking at all my stuff, like adding up, and she's like, what are you doing?
Yeah, it's interesting. We met in nursing school,
Okay.
many years ago. So we're both kind of in the health space, and she's very into, health, fitness, supplementation, optimization. We're very similar in that way, and it's nice to also, I guess, speak the same language in terms of the, medical terminology and so forth. Like if she was an engineer, for example, it's like she wouldn't understand the things I was saying. I wouldn't understand, like things she was doing. So some people, they don't want to like have that, like where there's a Venn diagram that's basically a circle.
Yeah.
But for us it works, and we
That's
like
cool.
it. But I've had the same experience with patients, like where either the husband or the wife is totally into like the health optimization and supplements and this and that, and the other person's kind of like, why are you doing all that? They
Yeah.
just they don't get it, or haven't tried it. But then a lot of times you can, I guess, rope that person in, get them into health optimization as well, and then you have sort of health as a family, which I
Yeah.
think is the the best approach. So it doesn't mean that that person has to start taking 40 supplements too, but getting some blood work's a great start.
And my wife and my family in general are extremely health conscious, but I think probably rightfully so. She just thinks I get a little extreme with things, but that's just my personality. So James, I thank you so much for taking time to be here. I would love for you to tell people like how to find you, and if there is anything else that we didn't touch upon that you either want to promote or bring up, like I give you the space now to kind of do that as well.
Yeah, thanks again. Thanks so much for having me on. People want to follow me and what I'm doing. My main platform is on Instagram. It's at James O'Hara NP. I also co-host the Gillette Health podcast with Dr. Kyle Gillette, where we talk about all sorts of health topics and try to provide people with tools to have a balanced approach to health. You can find that on YouTube, Spotify, Apple Podcasts. Just type in Gillette Health Podcast; it should show up. And then, as I mentioned, our website, GilletteHealth.com, is where you can go if you want to find out more about becoming a patient or ordering self-service labs or scheduling an a la carte consult. That website is where people can do all those things.
James O'Hara, I really appreciate you, man. I'm going to continue listening to your podcast. It's awesome. You guys do a great job. And again, thank you so much, man.
Yeah, you're very welcome. Thanks so much for having me on, and appreciate you listening to the podcast. Thanks for the kind words.
Yeah, man. All right, we are off. Let me hit stop here.